What new medications and technology are changing the game in addiction recovery? For decades, addiction was misunderstood as a moral failing. Today, science reveals the truth. Addiction is a disease rooted in brain chemistry. And with that understanding comes hope. New medications and cutting-edge technology are transforming recovery, offering tools that address the biological roots of addiction like never before. One of the most promising developments is the use of GLP-1 medications. Originally designed to treat diabetes and obesity, drugs like semaglutide and tirzepatide are showing remarkable potential in reducing cravings for alcohol, opioids, and other substances. These medications work by regulating the brain's reward system, helping to quiet the compulsive urges that make recovery so difficult. Early studies and patient testimonials suggest that GLP-1s can be game changers. People report fewer cravings, better control over their impulses, and renewed hope in their recovery journey. GLP-1s are FDA approved for diabetes and obesity, but are being used off-label and studied for addiction. Research is ongoing, and many experts are optimistic. Meanwhile, long-acting implants are making it easier to stay consistent with medication. Instead of daily pills, these implants release medication like naltrexone gradually over weeks or months, removing the burden of adherence. This consistency reduces the likelihood that cravings will resurface and derail progress. But medication is only part of the picture. Artificial intelligence is emerging as a powerful ally in preventing relapse. AI algorithms can analyze patterns in behavior, mood, and communication to predict when someone might be at risk. This allows for timely interventions before a crisis occurs. This is still in early stages. But clinics and rehab centers are beginning to pilot AI tools that help counselors tailor treatment plans in real time based on data about each person's unique triggers. Virtual reality is also making waves in addiction treatment. VR therapy immerses patients in controlled environments where they can practice coping strategies and face triggers in a safe, supportive setting. It's an innovative approach that's showing real promise in clinical trials. Telehealth has revolutionized access to care. Remote therapy sessions and medication management mean that people in rural areas or with limited mobility can still get the support they need. It's breaking down barriers and making recovery more accessible than ever. Of course, these tools aren't one-size-fits-all. Some people may experience side effects from medications, and not everyone has access to the latest technology. But staying informed about new options can empower you or a loved one to make better decisions about treatment. It's important to remember that medication and technology are supports, not silver bullets. Recovery still requires connection, community, and compassionate care. But when combined with therapy, peer support, and personal commitment, it's support that makes that work a little easier, a little less lonely, and a lot more hopeful. These innovations can make the path to recovery smoother and more sustainable. If you or someone you care about is struggling with addiction, know that help is available. Talk to a healthcare provider about the latest treatment options. Explore telehealth services. Ask about new medications and therapies. The landscape of recovery is changing, and there's more hope now than ever before.